Hi, I'm Dr. Michael Richman, a double board certified cardiothoracic surgeon. So yesterday it was reported in the media that a British doctor named Jo Ward has taken to TikTok to share her expert advice on the best way to take vitamin D supplements and has warned that you should never take it on its own because it causes calcification in your arteries. And I'm quoting that. Wait, what? It's insanity. Sometimes you just need to call out BS. And this is what I'm doing today. Apparently her post has gone viral. Now, who is she? So from her website, it says she's a general practitioner with a special interest in dermatology, aesthetics, and longevity medicine. Come on, everybody. She has an interest in something and that makes her an expert? Do you really think somebody who has never had formal training in dermatology is a dermatologist? I mean, let's be real. Then there's also no formal training in longevity. And then wellness, I'm interested in wellness too. I don't sit and walk around and claim that, quote, I'm an expert in wellness because nobody is. Anybody who wants to be an expert, especially on TikTok, can say that they're an expert in anything, right? All they need is an opinion, an audience, and something to sell. Frankly, I could care less what she says, and so should you. But let's talk about what she did say. She stated that vitamin D should always be taken with vitamin K2. And the reason why is if you take vitamin D on its own, it can cause calcification and blockages of the arteries. Okay, this is absolute stupidity. And somehow that vitamin K2 prevents this. So it's a really good idea to find a formula with K2 and vitamin D together. And apparently she's had multiple thousands of likes and comments. Thank you. I agree with you. First of all, she forgets that the major way vitamin D gets into your body is through sunlight. There's no evidence from randomized human trials that vitamin D taken alone causes arterial calcifications or blockages. First of all, she forgets to talk about calcium, but let's talk about how calcium is brought into the body. It's absorbed into the intestine when you eat it, both actively, so something transports it across cells, and passively through the cells. And the presence of vitamin D, especially in its active form, which is called calcitriol, is essential for efficient active transport. Okay, dietary calcium intake and calcium supplementation do not consistently translate to increased arterial calcification unless they result in sustained elevations of your calcium level in your blood. The most direct evidence comes from a secondary analysis of a randomized controlled trial in which community-dwelling adults aged 55 to 70 who were deficient in vitamin D were randomized to receive vitamin D3 at doses of 400, 4,000, or 10,000 IU daily for 3 years. It's a long time. The study found no effect of vitamin D supplementation on the development or progression of tibial artery, which is an artery down in your lower leg, calcification across all dosage groups. No new calcifications developed during the study period, and the progression of existing calcification was not influenced by vitamin D dose. Comprehensive reviews and meta-analysis of randomized controlled trials and Mendelian randomization studies also consistently report no causal link between vitamin D supplementation and increased risk of arterial or coronary calcification in generally healthy populations. While animal studies have shown that vitamin D intoxication can induce vascular calcification, these findings have never been replicated in human randomized trials at clinically relevant doses. Okay, so what's the take-home message? Don't believe what you read or what you hear if somebody says it and they're not an expert in it, okay? Like, go to Google and Google it and see what their qualifications are, especially when they're giving medical advice. It's insanity. So with that, I hope you learned something today. Thank you for listening. And I hope you have a great day. Thanks.